When assessing an injury to muscle, bone, or a joint, it can be difficult to determine if it is an emergency or if delayed care is appropriate. When in doubt, it is best to seek professional evaluation and treatment. There are some simple steps, however, to help individuals decide what actions to take in response to sprains, strains, or fractures. The most common and easiest to treat injuries include contusions or bruises from blunt force, strains, which is the wrenching or twisting injury to a ligament in joints, or sprains, an injury to a muscle or a tendon due to force, overstretching, or overuse. These injuries often result in pain, swelling, some loss of function, but can be treated at home. More severe injuries that require medical intervention and advanced care are fractures or broken bones, dislocations, and partial or complete tearing of soft tissue, including ligaments, tendons, muscles, and cartilage. When assessing injuries, look for deformities and misalignments, sudden and severe swelling, and be mindful of open wounds. You can check the skin to see if it's warm to the touch, has good color, check for loss of function and weight bearing, and check for sensation, tingling, and numbness. Injuries that do not require an ambulance but do require immediate care should be stabilized before transport to minimize patient pain and further tissue damage by padding, splinting, and applying ice to reduce pain and swelling. EMS should be called whenever there is an injury that includes a loss of consciousness, an open fracture, dislocations and fractures that cannot be safely or comfortably transported by private vehicle, a fracture that debilitates the affected limb, or there is a violent mechanism of injury. Very young patients or elderly patients that have multiple injuries should be transported by ambulance. If you do decide to self-treat injuries, they should be closely monitored for worsening symptoms, and the injury should be treated by immobilizing or restricting the use, ice, compression, elevation, and SAM splints and elastic bandages are an inexpensive way to ensure that you always have a splint on hand. SAM-type splints are foam-covered aluminum that are flexible when flat and become rigid when curved or bent. These come in many sizes and can be used for the hand, wrist, arm, ankle, lower leg, and can even be used as a C-collar for neck injuries. To use a SAM splint, form the splint on the unaffected side. Bend the splint to fit the injured area. Do not straighten the injury to fit the splint. Secure the splint with an elastic bandage, tape, triangle bandage, or anything available. Make sure the wrapping is not cutting off the circulation or affecting sensation. Transport the injured person to the ER or call EMS. There are manuals and internet links with instructions on how to use a SAM-type aluminum splint in a multitude of situations. The best way to use any type of splint is to problem solve and focus on the goal, immobilizing and protecting the injured limb until advanced care can be reached. With this in mind, you can make an effective splint out of a variety of objects and materials in your surroundings.